In this presentation, we're going to talk about Hofstede's dimension of uncertainty avoidance. So at the end of this learning activity, we expect you to be able to describe what is the value orientation of uncertainty avoidance and explain how uncertainty avoidance could affect the healthcare system, the interactions between patients and professionals, and the healthcare practices. What uncertainty avoidance stands for? The uncertainty avoidance dimension expresses the degree to which the members of a society feel uncomfortable with uncertainty and ambiguity. And of course, this could affect change or flexibility. This dimension is also very relevant to intercultural contacts, as it reflects the fear and anxiety about what is new or different that is perceived as threatening, or on the other hand, an attitude of curiosity about the unknown or the different. In high uncertainty avoidance countries, they maintain rigid codes of belief and behaviors and are intolerant of unorthodox behaviors and ideas. Although sometimes some of the rules are not followed. They also disapprove deviant opinions. While in low uncertainty avoidance, these societies maintain a more relaxed attitude in which practices counts more than principles. So how this could affect the health field? What examples we could have? It is possible that patients for instance, in high uncertainty avoidance societies would like to have a clear diagnosis and prognosis. They also may need very structured information with clear examples of what to do. And patients probably want to know the right answer, and the right answer will have to come from the expert, from the professional who will have to provide the information. If we take it into the relation with professionals in high uncertainty avoidance, they need to have like very clear specific tasks. They may really like protocols, and they will be really necessary in these societies. And it is possible that it's more difficult being flexible and adapt the care to the situations of the patient. As well, probably being innovative and open to changes in the way of care, it may be more difficult. And it is possible as well that it could even affect the application of the latest research, because it is more difficult to change, as we mentioned. As well, this could affect being in front of an audience, because it is very threatening. Making mistakes is embarrassing in this context. So in that sense, if we would be in teaching classes in the healthcare field, inducing reflection, it is more difficult. And with patients, having patients to participate in sessions, it will also could be more difficult. So we could find examples, for instance, in low uncertainty avoidance, and how this could affect the health care situations. In this context, patients are more tolerant with not having probably a definitive prognosis. It is interesting, but this dimension correlates to the perception of health, of being having greater health and patients are more open to change the treatment in relation to what they observe and experience. So they can have like that uncertainty of being observing and not having the right or wrong path. In this context, providers make more eye contact with the patient, and they spend more time building a rapport with the patient. Again, we present you the map that is taken from Hofstede website, where you can see how uncertainty avoidance is distributed around the world. But if you want to be more precise and you want to know the score of this dimension in the different countries, as we can always mention, you can click this website, this link, and you can go into the website where you can type the countries you want to compare. So you will obtain the score of each country per dimension, where 100 indicates the highest score in uncertainty avoidance and 0 the lowest in this dimension. Now we invite you to reflect on how this dimension could affect healthcare in all of these situations: patient perceptions and health well-being, the role of carers, autonomy, independence and decision-making, and so on. And after reflecting on those, on how this dimension could affect these aspects, we invite you to answer the following questions.